Sue Kushner, and I am representing MS Insight with a very special guest today, Rosalind Kalb. Let me tell you a little bit about MS Insight, and then Roz, and I will just say what I do, and we will go from there. So it is October, which is Mental Health Awareness Month, and very, very important in the age that we are living in on a number of levels: COVID, politics, general stress, everything. So I am representing, as I mentioned before, MS Insight. And MS Insight is working to enhance the lives of people with MS through education, information, dialogue, and insight. We are a new organization, and we are hoping to convey really useful information to people with MS, particularly patient to patient, along with covering bits and pieces of new information from professionals that we are fortunate enough to get some of their time to share with you. Now, let me turn my attention to Roz, who I have known for a number of years. Roz is very, very well known in the world of MS. Roz spent many years working for the National MS Society. Roz is a clinical psychologist, also involved in research, private practice, many types of organizational work, currently works for Can Do MS, formerly the Huga Center, formerly the Jimmy Huga Center, and that's where I know her for years from. And my name's Sue Kushner. I'm a physical therapist, and I teach at Slippery Rock University, and I'm very excited to be involved with MS Insight and to share information for folks with MS. So I'm going to let Roz say a little introduction to everybody, a little bit more about herself, and then I'm going to pepper her with some questions that I think our audience will find very useful. So thank you again for your time, Roz.
Thanks, Sue. It's really fun to do this with you. We really have known each other for a very long time. And a lot of what I know about rehabilitation for people with MS, I learned from Sue over the years. So this is really exciting for me. I've been in the field of MS for 40 years now, beginning at a comprehensive care center, and then, as you said, at the National MS Society, and now at Can Do MS, and it is the passion of my life. So I am very excited to be here.
Right. Well, thank you again for your time. So would you please share with us what are some mental health issues that people with MS share above and beyond the struggles that most of us do on a daily basis, COVID, etc.?
It's an important question, and one of my favorites to talk about. So we now know that some of the mental health issues, depression, anxiety, irritability, some of those things that people with MS experience are actually hardwired into the disease. They are not just a reaction to living with a very challenging, unpredictable illness, which is hard enough, but that there are changes in the brain and the immune system which cause some emotional upheaval. And that means that people with MS are much more likely than people in the general population to experience depression and anxiety. So more than 50% of people with MS are going to experience a major depression at some point over the course of the disease. And similar, there hasn't been as much research done in anxiety, but we know that the numbers with anxiety are at least as high. And what's important about that and why I care about this so much is this is not a pull yourself up by your bootstraps issue. This is not, if I just try harder, or if I'm tougher, or if I just bulldoze through this, I can manage these mood changes. There is nothing to be embarrassed about. There is no stigma. This is the same as managing your spasticity, your stiffness, or your bowel or bladder issues, or pain, or any other MS symptom. So we really want people to report changes in their mood as quickly as possible. so that they can get the help they need.
Thank you. And certainly we all like control over our lives, and MS is not very gracious about that. So I'm sure that's an added stressor too. And then why is screening so very important for people with MS?
Another good question. So I think there are two reasons. One, in today's healthcare environment, particularly in the treatment of MS, doctor visits are short and they are pressured. And there is a lot of focus on disease modifying therapy, a lot of focus on looking at one's MRIs, and in my opinion, not enough attention to symptom management, including mood changes, right? So uh, the National MS Society now recommends that every person with MS is screened for depression at the time of diagnosis and at least yearly thereafter. And the reason is that when you recommend screening like that, it's more likely to happen. People with MS are more likely to self-advocate and go to their health care provider and say, I would like to be screened for depression because I think my mood has changed. And neurologists and other healthcare providers may be more likely to make time in the appointment to check in on somebody's mood, because otherwise it can be a don't ask, don't tell. Never comes up because it's not at the top of the list. And living with depression makes life with MS even harder than it already is.
So extremely crucial that this routine screening is occurring.
Extremely crucial. And for people who get pushback or can't get the screening they want, I also want to let them know that Mental Health America, which is a wonderful organization, offers free confidential online screening for depression, anxiety, and other mental health changes. And you can simply go to Mental Health America, Google it, go to their website, you sign in, they use validated screening tools, you answer questions, you get a report, a confidential report back to you by email. And if you screen positive for any of these mental health conditions, whether it's bipolar disorder or anxiety or depression, you can then take that to your healthcare provider and say, this is a screening tool I took that's been validated, and I need to talk the results over with you because I'm concerned.
Okay, excellent. And we know that MS is not a visible disease in and of itself usually, and then the mental portion, of course, is not visible to anybody. So, it's such a silent factor that must be paid attention to. And then we come to support partners. We know how crucial they are in people's lives. Um, so what type of mental health issues may they be experiencing?
We know that support partners in general, not just for people with MS, but support partners of anyone living with a chronic or disabling illness, are also prone to depression and anxiety and other changes. But if people with MS are unlikely to be asked about their mood and how they're doing emotionally, support partners are really unlikely to be asked because they're kind of invisible to the healthcare team very often. I mean, one of the things I'm so proud of about CAN-DO multiple sclerosis, and you know this, Sue, is that we focus as much attention on the support partners as we do on people with MS because they're a partnership, right? And they need to be taking care of each other. And so when support partners aren't asked and they're left to manage their own concerns and needs and fears, their emotions can get out of control as well. And then nobody's able to function well or function comfortably. So we always try to find out how support partners are doing to encourage them to talk about their own emotional needs, that their feelings and needs are no less important than the person who's living with the disease itself. So it's a two-way street, and support partnerships thrive when each person is looking out for the well-being of the other and encouraging their partner to get the care they need.
And I understand it can be sometimes like a house of cards, just when the support partner goes, the whole thing falls down. And yeah, it's so, so important. And for 30 years, I've been so impressed with Can Do MS, how support partners get equal billing, equal attention, equal issues to, yeah, it's really incredible. So then comes to the day and age that we are living in the lovely year of 2020. So how has COVID increased mental health struggles for persons with MS? And then has there been any silver lining? Please, please.
So yes, I think there have been some silver linings for all of us, although you have to really dig deep deep to find them. But I think in general, everybody's anxiety is way up. And people with MS had very specific concerns about whether they were at greater risk because of having an autoimmune disease. And the good news is that we know that people with MS are not at greater risk of developing COVID. They're the same as the general population. But we know that they do need to talk to their healthcare providers about the type of medication they're taking for their MS, because that can have some impact on susceptibility. And we know that if they have other health conditions along with their MS, and this is true in the general population as well, if you have other health conditions, breathing problems, cardiac problems, anything like that, then that increases your risk on top of your MS. So people need really good information about what their risks are and aren't. And that's one aspect of it. The second aspect of it is that families are trying to manage this risk as best as they can. So other family members may have to go out of the house to work. Somebody's got to go to the grocery store or at least figure out food. There are all kinds of ways in which we have to interact with the outside world. And what can cause tension in families is when each person's tolerance for risk is different from other people's in the family, right? So one person in a family may say, well, I'm going to be really careful and I'm going to wear a mask every minute. And when I go out of the house and come back in the house, I'm going to change my clothes and I'm going to take a shower and I'm going to wash my hands. And somebody else doesn't feel that same level of risk or lives by different kind of rules for how to manage it. And then that creates some, head banging stuff. And so how to negotiate that? How do you keep everybody in the family safe? And I think right now, everybody's just getting really sick of it, right? It's gone on much longer than any of us expected and much longer than most of us felt it needed to go on. And so now people are letting their guard down, and that's making anxiety really skyrocket. The other thing we've heard from people with MS is that they feel lonely and isolated. They're cut off from family and friends, and it's just feeling very closed in and trapped. But one thing I have pointed out to many people in our large can-do audiences when we've talked about COVID is that in some ways people with MS have a head start over the rest of us. They have learned a lot about dealing with loss of control, with loss of independence, with unpredictability, because you and I know MS is the most unpredictable disease there is. And so I remind people living with MS and their support partners that they've had a lot of practice with this, and they're actually teaching some of the rest of us how to live with the uncertainty of COVID. So they bring strengths to the table that I really want them to recognize and embrace, because it's hard. I think in terms of the silver lining, we have learned many new ways to connect with people that we just never bothered to try before. And we're getting used to talking like this, from a
Yes, for sure.
distance. But that means we've connected with people that we haven't connected with in a long time.
Mhm.
Relatives, friends, suddenly we're rediscovering connections. That's strength. I think the other wonderful thing is that people are discovering new interests, new hobbies,
Mhm.
new joys that they hadn't ever tried before because there was no time or space or reason to try them.
Right.
And this is a time to be creative with yourself. Like I started painting, and 2 days ago, I had this joyous time with my 8-year-old granddaughter.
Oh,
She was painting at her house, and I was painting at my house, and we're talking and sharing a new activity together.
mhm.
So I really encourage people to think outside of the past, think about different things they want to experiment with, because this is a good time to do it.
Yeah, and you have to stay sane, and you have to we all have to deal with the hand that is dealt to us, be it MS, COVID. And I know just people getting outside this summer has been wonderful. We have found in the whole healthcare realm that, boy, we're able to do a lot of consults and carry on with some treatments through Zoom or whatever the platform is. And that has been wonderful. Some people may do, 3/4 of their healthcare in the future this way. It
I
saves
think
them
it's really
time.
going to expand mental health opportunities,
Mhm.
right?
Yeah.
Where you don't have a mental health person close to you, and now you're going to be able to connect and get help. And we've also discovered through our Can Do meetings, we're doing a lot of coaching, individual and group coaching, and just consultations by Zoom, and that some people who had thought they could never go to a psychologist's office or a
Oh,
counselor's office and talk find it very easy to do from home. They feel safe, they feel secure in a familiar environment, and they just talk and they're getting help that they never thought they could get.
mhm.
So that's a real positive.
Yes, isn't that wonderful? And just spending a little bit more time with loved ones, or, maybe trying to avoid people that you wanted to avoid, and you can really do that now because you don't have
Right.
to see them, in whatever atmosphere. So, and then Roz, who are the healthcare professionals that can help individuals and their families manage these mental health struggles and issues?
So there are several different professionals, and it is important to know the distinctions between them. So a psychiatrist is a medical doctor who has chosen to specialize in psychiatry, just like a neurologist has chosen to specialize in neurology or whatever other group. So they go to medical school and then they do residencies in psychiatry, and they can prescribe medication. And in today's healthcare model, psychiatrists are typically doing diagnosis and medication management. Some psychiatrists also do talk therapy,
Mhm.
but for the most part, the way insurance companies are set up, um, you can see a psychiatrist for diagnosis and medication, but you would get your therapy from somebody else. The folks who do talk therapy can be psychologists like myself, clinical psychologists, health psychologists. That's a relatively new field, at least from my advanced age perspective, health psychology. And many of them are working in chronic illness like MS or Parkinson's or other diseases because they have a special interest in that. Um, there are also neuropsychologists who specialize in the diagnosis and treatment of the cognitive issues that are so common in MS. We haven't talked about those, but those are very, very important to manage because they're also very common in MS. So neuropsychologists are an important member of that team. Social workers, marriage and family counselors, psychologists, we all do talk therapy. We do not, however, for the most part, prescribe medication. In some states, psychologists can prescribe medication, but most not. And then there's another group that people should know about, because psychiatrists are few and far between. There are not enough psychiatrists who have accessible offices or CMS patients. And so it's really important to know about psychiatric nurse practitioners. And they also diagnose and treat mental health conditions, and they can prescribe medications. So depending on where you live, you may be able to find a psychiatric nurse practitioner if you can't find a psychiatrist, and they often also do psychotherapy, just like the counselors and the psychologists.
Okay, excellent. And then I suppose the cream of the crop would be any of those healthcare professionals who know MS very, very well.
Right. So if possible, you want to find somebody who's familiar with MS, so you don't have to spend all your time teaching
Right.
your provider about the disease. So I think one of the best places to start is to call the National MS Society, which has a huge database of providers around the country. And people can call 1-800-344-4867 and talk to an MS navigator and say, I would really like to find a mental health professional in my area who is familiar with MS, has experience in MS, and they will do their best to help you find somebody within a reasonable distance.
Yeah, they are excellent in giving appropriate information for that person's geographical area, and they have what are called the partners in care partners in MS. You're familiar with that. Yeah, it's wonderful and necessary. And then what types of interventions are helpful? I know you already mentioned the talk therapy and medications, and anything else that is extremely helpful to our population with MS.
So I think of it as kind of a three-legged stool. I believe that the best combination of treatment is medication, if you need it, to help manage your mood changes. Talk therapy, because they really do two different things, right? The medication deals with whatever the changes are in the brain. The talk therapy helps you work through the issues, which no matter how good a medication is, medication can't fix the life challenges that you live with. So you talk about the life challenges while the medication helps you feel able to talk about and deal with those changes. And then we've learned a lot about exercise and mood over the past couple of years.
Yes.
Yes. And so I really strongly recommend that people work with somebody like you, Sue, a physical therapist, to identify the best exercise program, regardless of what their ability level is. And we now know that there's good exercise for people, whether they're newly diagnosed and have no symptoms at all, or have very, very advanced symptoms of MS. There is exercise that can be helpful, and that improves mood. So that's my three-legged stool: talking, taking a medication if it's recommended for you, and exercise.
I do love the three-legged stool analogy. And coming from a physical therapy background, I will say that we can meet you wherever you are at this point in time. We will find something that is agreeable to you and helpful. And so, but again, the person has to seek out the help. And then what other type of coping and self-care strategies are helpful for a person in addition to the professional help?
So I'm really glad you asked that, because I think there are a lot of things that people can do. And we've learned a lot, again, in this COVID environment. um, that people get a lot of support from each other. And in the past, in the old days, it was all about um, finding a support group, whether you were a person with MS or you were a support partner, finding a local group that you could get together with. And, if you live in a big city, there are lots of those groups. But if you live in rural Nebraska or rural anywhere, it may be hard. And now we've learned that people can gather online and learn from each other all the time. We are doing it many times a month at Can Do MS, where we have large Zoom programs where people learn, but they also share and problem solve and support one another. And it's wonderful. And I think that doesn't take the place of psychotherapy or medication if you need it, but it supports those efforts, right? So you need to treat depression if you have it, and you need to treat anxiety if you have it. But in terms of living your life, support from other people is incredibly important. And now there are new ways to get that. Mm. I also think that self-compassion is pretty important. We are so hard on ourselves, and we have such high expectations, whether we're living with the disease or we're support partners. I feel guilty that I don't do this. I feel guilty that I do this. I feel guilty that I'm not pulling my weight. I feel anxious. Taking the time to acknowledge what each of you in the family do for each other and being patient with each other and patting yourselves on the back. I also think that finding some spiritual practice of some kind, and everybody's is different. It doesn't have to be religion, doesn't have to be formal attendance at a place of worship. It can be anything that helps you feel grounded, connected to the world around you, that gives you some feelings of peace or joy. For some people, it's music. Others, it's meditation, or I don't know, walking and enjoying nature. It doesn't matter what it is, as long as you find the time and space in your life to just connect with your inner self and the world around you. That can be so comforting and soothing in a time that is pretty uncomfortable right now.
Yes. Something that just brings you some peace. So,
right.
Yes. And amen to that, and pun intended. And I think what you have brought to our audience today is so helpful. The volume of tools in your tool belt, or tricks in your bag, it is so important for people to have just a nice array of things and other people to help them with in navigating not only the disease, but the mental health issues, and especially, again, during the obviously increased stressful time that we are in now.
I think that's really important, Sue, because I think there are a lot of people who feel they have to go it alone. That reaching out for help or saying I need some help is a sign of weakness. And for me, after all these years as a psychologist, I think reaching out for help is one of the best signs of strength one can ever exhibit, right? It's saying, right, I'm ready, I need this, what resources or support can you give me? And I don't want anybody to feel like they have to live with MS alone. It's too hard.
We are stronger together. Not saying that we don't all need our alone time. Boy, the more you read lately, people all inside and with each other. Yes, carve out your alone time, but in general, bring these healthcare professionals into your life. Bring the mental health help to you, bring the loved ones to you. And like you said, ask for help, reach out. And most people are so happy to help each other. And again, it's strength, not a weakness. So, well, Roz, thank you so much from the bottom of my heart, and for our audience out there, as we really are trying to get MS Insight up and running and be more of a presence and partner with the National MS Society and Can Do MS and all the wonderful organizations that are out there. And we are all excited to eventually be seeing each other all in person again, wherever that may be, whatever it may look like. But until then, keep Zooming and teaming